Okay, okay. Let's get started. Let me start by saying good afternoon and welcome to Sunnyside of Wortham High School for the opening of a new COVID-19 testing site. I want to start off by acknowledging a few people from the very beginning. Of course, we have Congressman Al Green from the 9th Congressional District who's with us. And then we have Kathy Bluford Daniel, who's on the HISD School Board, along with Camille Foster, the Chief of Staff for State Senator Boris Miles from District 13, who's here. I know Commissioner Rodney Ellis is on his way. I believe State Representative Sean Theory from District 146 is scheduled to be here as well, along with State Representative Alma Allen of District 131. I also want to acknowledge Director Steve Williams with our Public Health Department and Dr. David Purse, who's our Medical Director. But in addition to that, I want to especially acknowledge Marlene McNeese and Deprecia Limbrick, who are the incident commanders with the Department of Public Health. Where are they? Y'all can come a little closer. I want to acknowledge both Marlene McNeese and Deprecia Limbrick because they are the incident commanders on the ground, helping to facilitate and make all of this happen. I know you see us all of the time, but I do want to acknowledge the hard work that the staff of the Health City of Houston Health Department have done in setting up all of these sites and doing it very, very quickly. So very much appreciate what you all do, and please extend my thanks to the others in the health department because they've been working night and day. And then this is a site that's also been stood up in collaboration with the Texas Department of Emergency Management, and NEMKID is over that, over TDEM, and so I want to acknowledge them in the state as well. We're in district, this is district... D. Oh, I'm sorry. This is... This is it. We're in District D. I knew that, but I wanted the council member to echo it out. And I certainly want to recognize the council member, Dr. Carolyn Evans Shabazz, for her presence and the work that she's doing in her district, but quite frankly, it's having an impact across the city as a whole. So thank you, council member. We have other COVID-19 testing sites across the city, and this one will bring vital COVID-19 testing resources closer to vulnerable communities. In fact, this is one of those communities that was highlighted in the Houston Chronicle's article a few days ago as being, I guess you can say, one of the hotspot areas of the Sunnyside area. And I know this is one of those areas, in addition to the council member wanting the testing site here at Wortham, State Senator Boris Miles has been an advocate champion of putting a testing site here as well. It opens today and will operate through May the 3rd, daily from 9 a.m. to 5 p.m. or until the site reaches its daily capacity of testing 150 people. So that's the capacity for this site. It's a mobile testing site. 150 is the capacity. This site requires an appointment because it's limited in terms of capacity. It requires an appointment, and you can make one by visiting txcovidtest.org, txcovidtest.org, or by calling 512-883-2400. That's 512-883-2400. We know that African Americans and Hispanics, along with the elderly and people with underlying chronic health conditions, are disproportionately getting sick and dying from COVID-19. If you do not fit that description, it might be easy to look the other way, but we all have a responsibility to protect the vulnerable in our community and in our families. As of today, the numbers for today, we are reporting 96 new cases of people who have tested positive for COVID-19. That will bring the city of Houston's count to 3,515. So we're adding 96 new cases today. And as of today, we're adding 2 more to the count of people who have passed away as a direct result of COVID-19, and that will bring our total count to 52. The 2 persons who who we are adding to that list today is a Hispanic female in her 90s that died on April the 15th of underlying medical conditions, and also an Hispanic male in his 70s who died on April the 24th, also with underlying medical conditions. So as you see, when you combine African Americans and Hispanics in terms of the number of people who have died within the geographical limits of the city of Houston, Hispanics and African Americans are making up pretty much about 75% of that 52 that have passed away. And we also know COVID-19 is more widespread in our community, hence this testing site here. There are more people who likely have the virus and are not showing symptoms and have not been tested but could infect others. And that is why testing, and more testing is important, especially as the focus shifts to returning to work and reopening businesses. And we all want to make sure that people are maintaining social distancing, wearing face coverings, and that we are doing as much testing as possible, because the test becomes our eyes in terms of where this virus is and will give us a better indication of how prevalent it is within our community. Is the curve flattening? Yes, the curve is flattening. That's I think the data and all of that indicates that the curve is flattening, but we haven't yet reached the peak, and so we must remain vigilant and keep working to stop community spread of the virus. Today's opening of a COVID-19 testing site in Sunnyside underscores that the fight to end the pandemic is not over and our work is not yet done. And we will keep testing and taking other measures to save people's lives. Now, at this point, let me yield and let me first bring up the Councilmember Evans Shabazz, for her remarks.
Thank you, Mayor, and certainly thank you on behalf of the constituents of District D, the District of Destination. And so certainly I am very appreciative to the Mayor for his leadership and for providing masks to the constituents and to the city. I want to certainly thank our Congressman, Al Green, and just let you all know that we are so appreciative, and certainly to the Senator, Boris Miles. Just so appreciative. I used to actually work at Worthing High School. Certainly I want to say that I know that we're talking about opening the city, but these masks are very important. I said that I would rather cover my face with a mask than be covered with a sheet. And so certainly I know the importance, and I want to highlight two events. One is at the Southeast Community Church tomorrow at 11 a.m., where we have Pastor Thurman West and Pastor Terrence Hall. At 11 a.m., they will be giving out masks and gloves. And today we will have communion and mask at the Metropolitan CME Church, Pastor Alan Page. Come out, get communion, get gloves and mask, and that will be from 10 to noon today, Friday, and Saturday. And so certainly thank you to all of you, especially to the media, for getting this word out. And we're going to flatten the curve together. And thank you so very much.
Thank you. Congressman Al Green.
Thank you very much, Mayor. I greatly appreciate this opportunity and want to especially thank you because we had a conversation about having a site in Sunnyside, and you have responded expeditiously and positively. And for this, I am grateful. Also like to thank Dr. Evan Shabazz. She and I work closely together on many projects. This is but another project that we are working on. Senator Miles, who is not here, has indicated to me that he would have you know that he is here in spirit. And I'm honored to stand for him at this time and with him. I am the representative for this area. This is the 9th Congressional District. And I'm honored that we would have this opportunity to have members of this community accorded the opportunity to be tested. This coronavirus pandemic has highlighted the interconnectivity within humanity. 100 days in, and we've had nearly 1 million persons confirmed with cases of the virus. More than 5 55,000 deaths in the United States alone. Although today we are here in Sunnyside, this is really bigger than Sunnyside. Because what happens in Sunnyside can impact the east, west, north, south sides. It can impact all sides. And the lesson that we must learn from this inescapable truth is that we must concern ourselves with what happens to others because it can happen to us. It would be a mistake to conclude that we should not dispatch with all deliberate speed the necessary resources to vulnerable communities such as Sunnyside simply because it's not where we reside. Where we reside is always important. But this pandemic has demonstrated to us that that which was birthed across the oceans can traverse the oceans, span the mountains, and find its way to Sunnyside, Texas. We cannot conclude that we should only concern ourselves with where we reside. We're all in this together, and we will all come out of this together. United, we can. Not just we stand, but united we can. United we can have the testing. United we can have the tracing. United we can have the masking. United we can bring this virus under control. But it does require unity, and I'm proud that this mayor has extended the hand of friendship across all of the lines that sometimes divide us and has brought us together so that we can impact this problem, this coronavirus. Finally, Mayor, I want you to know that your health department has worked closely with us. They've done an outstanding job, and I'm proud to thank them here today for this. Remember, dear friends, this is not about just Sunnyside. It's about every person on the planet Earth. I thank you, Mayor.
Thank you, Congressman. And while we are talking, been told that testing has already started here at Sunnyside. I do also want to acknowledge Senator Boris Miles. He started early on calling and texting, wanting a site in Sunnyside and wanting a site right here at Worthen. So I want to acknowledge him, and representing him is his Chief of Staff, Camille Foster, and Kathy Blifford. Blifford is also here. Are y'all both? Camille.
Good afternoon. Senator Miles couldn't be here today. He had to be in the House. As you know, he had a kidney transplant, so he's a part of that group that would be affected adversely. But he was so excited last night when he got the call that this testing facility would be here. He has been advocating and fighting for this from the beginning, fighting for testing facilities to be in the African American community because we are the community that is being hit most by this disease. It's important now more than ever, since the economy is starting to phase back and reopen, that they get tested, that they know what they have, and if they do, they can be treated for it, and if they don't, that they can go ahead and go back to work and start a normal life. We can't stop. This is the first in the beginning, but he'll continue to fight for this and advocate for this. And again, he thanks Mayor Turner for listening to him. I know he's beat on his door and his phone often, Congressman Green, from the state to the local level. So this is important to him. He's very happy about this, but there's more that still needs to happen, and we'll continue to work. So just keep the faith and keep the fight. Thank you.
Thank you, Camille. You were very generous in your comments about beating on the door. He did more than that. I will tell you, I love you, my brother. I know you're watching, so chill. At this point, let me, and before I call up Commissioner Ellis, let me call us Director Stephen Williams. He's just been very vital and instrumental in this whole process and helping to facilitate these testing sites. And again, he's gotten a lot of those calls in Texas as well. So Director Williams, you can let us know what's happening out here today.
Thank you, Mayor. Good things typically don't happen without good leadership, good elected leaderships. And so I want to express my gratitude to my boss, Mayor Turner, Councilmember Shabazz, Senator Miles. You're right, he texted and called us a lot. Congressman Al Green, I want to acknowledge him because he actually on one of our first weekends, we were running out of supplies at Butler. He was able to help us access the masks. So I'm grateful for that help. HISD board member Kathy Buford, thank you for your participation in this. And County Commissioner Rodney Ellis, I get phone calls from him too, Mass, although I work for you. On Monday, I joined Mayor Turner and other elected officials in opening up a very similar site in the Southeast. That site, as well as this site, have one goal, and that goal is really to provide resources, testing to vulnerable communities. We know that COVID-19 is an equal opportunity virus. We know that there are certain people that will experience more serious outcomes if they are affected with the virus. That includes people that are 65 and older with underlying health conditions like diabetes, obesity, sickle cell, lupus, cancer, and other conditions. And so it is very important for us to really provide testing, in this case, and access to these vulnerable communities. People can visit HoustonEmergency.com for a list of places to get tested, and HoustonEmergency.com. As a health department, I'm grateful to my staff for being willing to answer the challenge related to COVID-19, and we commit every day to the challenges related to COVID-19. We will continue to do outreach in vulnerable communities and provide access via mobile sites or fixed sites. Thank you.
And of course, Dr. Purser, who's working right alongside Director Williams in all of this. Dr. Purser. There he is.
Thank you, Mayor. And I'd like to thank all the elected officials here because they've all contributed through this entire event. Elected officials have come together and been there when we needed them. As has been pointed out by the mayor and Director Williams, we're getting phone calls from elected officials, but don't think that we haven't called them and asked for help, and they've been there for us. So to all the elected officials, thank you so much for your help. And Mayor, I'd also like to thank you for pointing out the hard work of the members of the health department. So I wear two hats in the city of Houston. I'm the EMS medical director and I'm also the Public Health Authority. So in my role within the fire department, I have for many, many years, seen that first responders are recognized for how they go in to put their lives in line and put themselves in the line of fire sometimes with what they do. In my last 16 years of the health department, I've come to recognize that those folks who go out and deal with people who have infectious diseases in particular are also putting themselves in the line. But the health department workers, those people that go out in the street day after day, sometimes don't always get the same attention. So I want to thank you for pointing that out because Marlene and Decretia here represent a growing army of folks that we need to battle this really difficult problem with the coronavirus. On Monday, I gave an example of how a virus started a domino effect of cases from the Egyptian river cruise. And in that, I talked about a traveler from Taiwan who, at that point, we thought was the index case. And I want to thank, let me make sure I get the name right here. I want to thank the Deputy Director Chang from the Taipei Economic Cultural Office of Houston, who emailed me last night with some interesting information which we didn't have before, at least I didn't have before. And that was that some genetic sequencing research was done on that case. And it was determined that there is a high probability that that case was not infected in Taiwan, but rather was actually infected in Egypt. And so that was new information, but it underscores the point that I was trying to get across, was that with this virus being able to infect people without causing them to have symptoms, but allowing them to then spread the virus, we all need to have our guard up. We cannot drop our guard. And in that example, I pointed out how the people who are on that river cruise, and we've seen this with other cruise ships, the cruise environment is one which is really conducive to viruses, and we've seen this for many, many years, set off a domino effect where a large number of folks got infected. So it doesn't really matter who was the index case. The point is that any one individual, if infected and not knowing it. So this is why testing centers like this are so very, very important. So if people think that they have symptoms and think that they may be infected, they absolutely should take advantage of one of the many, many sites that we have available today. And now we're actually getting the testing sites out into those neighborhoods which traditionally don't have access to health care. And I can't underscore how important that is. So again, thank you to everyone who has facilitated that. And for those of you who come and get tested, an important reason for you to get tested is that if you should be positive, and I've said this the last couple of days, that then empowers you to protect your families. And just ironically, just yesterday, the New England Journal published an article, and it's a little bit small, but it talked about the amount of spread within a household if an individual is infected, and how that spreads within the people in their own home. So the people that we all care about most are our family members. So it turns out that on average, 16% of the people in a household would become infected by one person who was infected and didn't quarantine. But if they quarantined themselves, it dropped to 0. And not ironically, but they looked at which member of the household, and of course adults spread it to adults more than they spread it to their children, and spouses spread to spouses on nearly 30% of the time. So I want to make sure that people understand the value of how you become empowered to protect the people most important to you when you get tested. And then the other thing I want to point out is that we are seeing something. I'm going back to my emergency medicine EMS hat. We are noticing within the Houston Fire Department, we're noticing a decrease in our total call volume. It's down about 20% since the beginning of this whole thing. But more concerning to me, as we look at the data, most of those seem to be the non-emergent calls have dropped off. But more concerning to me is that we are seeing a slight decrease in the number of heart attacks that people are calling 911 as well as strokes. And so one thing about that is coming out and has been in the media about this virus is it does seem to affect the blood and cause clotting, and clots can cause heart attacks and cause strokes. So ladies and gentlemen, if you think you're having the signs and symptoms of a heart attack, or you think you're having the signs and symptoms of a stroke, you need to call. There was another article that was published actually just yesterday. It was a series of only 5 patients who had had strokes. They were all infected with the COVID virus. They were all less than 50 years old. And the lead article was of a young woman who had a stroke. She had developed difficulty speaking. She developed weakness in her arm and leg. And she didn't go to the hospital because she was afraid that she would catch the virus if she went to the hospital, because she didn't know that she was already infected. And so again, this virus is insidious. Please come to these sites to get tested. Take advantage of the testing that all the people back here work so hard to put together for you so that you can protect yourself and your family. And if you do that, you know, Houston has done really, really well when we compare ourselves to New York and New Orleans in particular. It's because people are doing the right things. Let's keep it up. The folks behind me are doing what they can to get the testing stations up. Y'all need to take advantage of it so you can take care of yourselves and your families.
Thank you, Dr. Peirce. And the city of Houston works very closely with the county. The county has been an incredible partner with the city of Houston. Judge Lena Hidalgo, as well as the county commissioners, and representing this area is County Commissioner Rodney Ellis.
Thank you, Mayor. All protocol observed. That's what I would see Mayor Turner do when he's traveling abroad. With these face masks on, I'm not sure who's standing with me anyway. But in case I want something out of it, let me thank Mayor Turner, the congressman, Senator Boris Miles, my cousin-in-law, the council member Shabazz, and school board members who are here. It is important. Look, I'm glad to be here, even if I'm late, because this is my high school. You're in the heart of Sunnyside. And I know that other people have spoken, so I just want to make a couple of quick points. Maybe somebody said it. It's an African-American neighborhood, obviously. Black people in America are 3 times more likely to contract COVID-19 and 6 times more likely to die from it. Now, why? It's certainly not because it's a black thing or it's a minority thing. It's because long before this virus showed up, the virus of inequality, the virus of lack of health care, the virus of food deserts, and all of those issues, dirty air in certain neighborhoods, our immigrant neighborhoods, our minority neighborhoods, has been around for so long. And those underlying factors exacerbate this problem. Second point, testing matters. Hasn't the world changed? Now the most important thing you can have is some isolation, a face mask, and a test. Testing does matter. In the state of Texas, I read, at least this was the case, Mayor and Congressman, a week ago, Texas ranks 49th out of 50 states in testing per capita. Just 332 tests per 100,000 people to date. Only Kansas is lower. And that's why, Mayor, I applaud you, the congressman, the council people, my colleagues in county government. It ought to be a bipartisan effort to get testing done and in neighborhoods that have more difficulty getting tests than others. So thank you, Mayor.
And again, I do want to acknowledge State Representative Sean Theory, who represents this area, District 146. I believe her chief of staff or staffer is also here, so I do want to acknowledge her. The district director for State Representative Sean Theory. And I know this is an issue that's very near and dear to her, and she's been very active and very engaged in this process. And I do want to acknowledge HISD, because they are allowing us to set up at this facility. Kathy Bluford Daniel is here as a trustee of HISD. So, trustee, thank you. And I do want to thank the superintendent. When I called and asked for permission to set up here, she readily agreed. So really want to acknowledge HISD. They have been a tremendous partner on multiple levels. The food distributions with the Houston Food Bank with HISD have just been awesome. And I do want to thank our collaboration here with the state, because this is the state Texas Department of Emergency Management that's providing the mobile unit, and we are partnering, collaborating with them. So I do want to acknowledge and thank NIMCAD for his collaboration. Quite frankly, all of this is on multiple levels. With the federal government, Congressman Al Green and all of them that are making available the dollars that we are needing for testing, additional testing. I want to thank them. Then the state, then of course our county, and then the school district, all working in collaboration with the city. Having said that, let me stop, and if you have any questions of anyone, this will be a good time to ask them. And that's that mic right there.
Mayor Turner, you've expressed that it's near and dear to your heart to make sure that vulnerable and at-risk communities get the testing that they need. So twofold, can you just reemphasize how much of a godsend this is literally to some people who don't have transportation, who otherwise don't have access to get to a testing site, one, and then two, what you're expecting to see as far as a greater screenshot of testing and results, considering a lot of these communities are on the front line at the grocery store, at the gas station, hospital, bank, so be it.
And the testing becomes even more important since the conversation has now turned to reopening. But you're reopening with whom? You're reopening with many of with employees and others that are coming out of these communities. So again, it's very important that we do the testing to get a better sense of where this virus is and how prevalent it is, so that we can detect, then trace, then follow up, contacts, quarantine, and treat. All of those things are critically important to really overcoming this virus. I would say we set up 2 public FEMA sites initially at Butler Stadium and Del Mar. And this was difficult for many people who are transportation challenged to get to those sites. They may have wanted to, but difficult. And it's not like you can get on a metro bus and just go there. So it was important for us to get into these neighborhoods. And on Monday, for example, we set up a site at Barnett Stadium, again in partnership with HISD, in the East End, very close to those neighborhoods. This one is in Sunnyside, so people can get to it relatively easy. Then there are some other mobile sites in Kashmere Gardens, as well as in Hiram Clark. And then the goal is to rotate those mobile units throughout the north side and other areas as well. So it's making it accessible. I think what we learned, and Commissioner Ellis spoke to it, the inequality that exists with access to health care. You don't want the inequality to exist because people can't get access to testing because they can't get to it. So we want to do as much as we can to ramp it up, to make it more widespread, robust. The term I like, ubiquitous, which means it's just pervasive, it's just everywhere. And with the $25 billion in testing that Congress has provided, earmarked for testing, and that will help us to further get testing out. The $404 million that the city has received in the CARES funding, we'll direct much of that to testing, contact tracing. So it's all about making sure that people who have faced inequalities in their lives, been on the margins for so long, that we don't leave them out and leave them behind. Again, of the 52 people who have died in the city of Houston, about 75% of them have been African Americans and Hispanics. 50 of them have died with underlying medical conditions. So hypertension, lung disease, diabetes, They may have been on dialysis, sickle cell, immune system low. So there are a number of factors. And so the testing will help to make sure that we can reach them timely so that they can isolate, be quarantined, or get the treatment early so that they don't end up in the hospital and on a ventilator.
My question to Commissioner Ellis. Honorable Commissioner, you used to be a state representative, and now you are at the county level. You talked about some of what we call the social determinants of health as they handicap the minority communities. But you are also aware of the fact that the city has what they call the Complete Communities program and initiative in place. The city has been doing a lot of work on healthy city initiatives, working with Blomberg and other related international cities doing similar work. So, to say that these issues are not addressed from the city level will be an understatement, but I want to say that what needs to be added from your perspective? Thank you.
Well, obviously, when you're trying to undo decades of inequality, it takes time to do that. And even in the midst of a pandemic, I think it's always important to stress that there are consequences to elections. And once we get in positions, hold us accountable for what we do, measure what we do, be informed, but also support it. So it obviously takes money that has to be invested in these communities, and the congressman and his colleagues have done a great job in the midst of this pandemic of sending money down at the local level. And then there's always a challenge for people on my level, and the mayor's level, the council members' level, the school members' level, to argue and figure out who controls it so we get it in the neighborhoods. So we're making progress, but it takes time. But just remember, a lot of these underlying issues that exist have been there for a very long time. And I think it's focus on them, like the mayor's concept of complete communities does matter. From the county's perspective, we're doing as much as we can with the lens of equity when we invest money. Even when the next round of funding comes from Congress, they put more of a focus on equity to make sure some of those small businesses get the money. On the county side, just yesterday, the mayor and I talked a bit right before we voted on it. We're going to put up about $15 million out of our emergency fund because we have it. And we're going to do it with an eye towards equity. You got to focus on people, as I refer to, catch the early bus. Not just the ones who have a business, but the people who have to clean the restrooms and that kind of thing.
Okay. Any other questions? Because otherwise the heat is speaking very loud and clearly.
Yes. Pool
yes.
photographer asking questions on
Sure.
behalf of
Sure.
Houston media. The county will use their money to help fund people pay their rent, but they're not going to use federal funds so that they can help undocumented immigrants. Does the city have something similar in place?
The city will be using some of its federal dollars for a rental assistance program, but we don't have the dollars to set up what the county is doing. I think they're pulling from their reserve, and I applaud them for that. The city of Houston, unlike the county and any other county in the state of Texas, has been operating under a revenue cap since 2004, and we've come bumping up against it since 2015. So we're using our reserve to simply make sure that we provide essential services and core services to the people in the city that need it most.
Okay. Next question from KPR.
So one second. Congressman.
Thank you, Mayor. I want to respond to your question because the question extends beyond the boundaries of Harris County and the city of Houston. This is a question for the federal level to give considerable thought to. And the truth is, we are trying our very best, many of us, to make sure that regardless as to how you got here, in this time of crisis, you're going to get the health care that you need, you're going to get the attention to sustain you, because what impacts any one of us can have an impact on every one of us. So this is important. And with reference to the inequalities that were mentioned, these circumstances, unfortunately, are treated as one-offs. They are siloed. And as they are siloed, one in each silo, we don't take them on in the systemic world that they exist in. These problems are systemic. And if we continue to try to treat them as an individual problem for an individual, we don't solve the problem. So we have a responsibility at the federal level to pass legislation so that we can treat systemic problems in a systemic way. Thank you, Mayor.
Thank you.
Next question from KPRC. What's your message to churches and places of worship since Governor Abbott's order will allow churches to open Sunday?
God is everywhere. God is in your living room. God is at your kitchen table. God is in your bedroom. If you pray to him, he will hear your prayer and he will respond. Don't feel compelled to go to any building. You know, he certainly will be at the building, but I will tell you before you leave your house, if you open up your heart and mind, he'll meet you there too. So engage in social distancing. God wants to save you, not hurt you, not harm you. And so that's because he's omnipresent and located everywhere. God will not put you in harm's way. That's what I would say. And, you know, let your spirit be your guide.
The next from Houston Chronicle. You said during city council that your proposed
and the
budget...
church said...
You said during city council that your proposed budget may dip below the standard 7.5 ending fund balance. Can you elaborate on that plan?
Well, we as you know, we have a huge hole in terms of, as a direct result of COVID-19, our sales tax loss can be around over $100 million. And, you know, unless we get flexibility, and I know where Congressman Al Green stands and is trying to assist us on every level, unless we have greater flexibility to utilize the federal dollars that we've already received, we're going to have to dip into our reserve in order to take care of our first responders, in order to make sure, for example, that city services are not reduced and we can move forward. This is just a sign of the times. I mean, COVID has impacted cities like they've impacted restaurants, corporations, oil and gas companies, you name it. We've been impacted. And combine that with the understanding that the city of Houston was already under a revenue cap. So we didn't just lose sales tax. We've lost municipal fees, parking fees. There are a number of revenue sources that would ordinarily come to the city of Houston that we have not been able to, that we're not going to be able to receive. So our financial policies say that we should always maintain a reserve of 7.5%. And ever since I've been mayor, we've always done more than that. This time, though, we may have to dip a little bit below 7.5%. And, of course, that's with the approval and the support of our council members. So they will get the budget the second week in May and have to evaluate it. But these are tough financial times for municipal cities as well as counties.
Just two more quick questions.
Okay.
This question is from Univision. Does the city plan to establish a COVID-19 mobile test collection site on the East End and Denver Harbor? We understand that there's a COVID-19 testing site at HISD's Barnett Stadium in Southeast Houston.
Well, the goal is for us to take these mobile units and to take them all over the city of Houston. In fact, I was in conversation with Councilmember Robert Gallegos in District I. And so he certainly has been advocating placing mobile units in, for example, in his districts and other places on the East End. Was in texting back and forth with State Senator Carol Alvarado. She's asking for testing sites for that mobile on the north side and in that end. The goal is to take these mobile units and to take them all around, and hopefully we can get some more. Right now we have one city mobile unit combined with, for example, this mobile unit is from TDEM, Texas Department of Emergency Management. So hopefully we can get several more.
Okay, KHOU. You mentioned rental assistant program coming before City Council next week. What do you have the details of that plan that you can share now?
Well, I do, but let me first talk with the members of City Council before I discuss it in the public. I mean, they have ideas too, so it's not just my idea; it's our idea. So give me an opportunity to talk to Councilmember Evan Shabazz and to the other 15 others, and then we can go from there. The goal is to have something before the members of City Council this coming Wednesday.
During your conversation with a Montgomery County judge about the reopening issue on Friday, what was his reaction to your concerns?
Well, he said that he was simply confused by the governor's order, that the governor's order, as it was written, did not say that bars and clubs and gyms could not open. In his reading, it simply said that you have to avoid getting the virus from these items. And so in his interpretation, the county judge's interpretation from Montgomery County, it did not say that these businesses had to remain closed. And so he did say that the governor was going to clarify his language today. I hope he does. But my conversation with the county judge in Montgomery County was simply to let him know that what he does in Montgomery County impacts what happens in the city of Houston and in Harris County. Bear in mind that the first community spread that was identified in the city of Houston was at the rodeo, at the barbecue cook-off, by a security guard that lived in Montgomery County. So you can't just open up Montgomery County and expect for the virus to stay in Montgomery County when people are driving down I-45 into the city of Houston and vice versa. So I want him to do what's in the best interest of Montgomery County, but at the same time, if what happens in Montgomery County impacts Houston, Harris County, then I think we need to have a conversation, and we did last night. And if what we do in Houston, Harris County impacts Montgomery County as well as others, then I think it's important to have a conversation. So last night we had a very pleasant, positive conversation because I think we all recognize that we're in this together.
Thank you all.
Okay. Thank you all so very much. Thank all the elected officials. Thank the city, the health department, and everyone else. Thank you.
Thanks, man. I started to say something about that revenue. I think you're going to get the rich. That's moving in your direction. It really is.
Because it's hard.
Air five.
I like what y'all are doing, man.
I didn't recognize you.
Hey, I'll turn around and try to get a picture with you.
You know, I forgot.
Okay.
I forgot to mention Alex.
Was he the?
Edwards, yeah. You want to do? Yeah, go ahead. And then I'm going to say something.
1 second. Is it? Did it turn on? Yeah, I'm sorry. I'm remiss. I'm remiss. I certainly wanted to mention State Representative Al Edwards, former State Representative Al Edwards, who passed away last night. He was simply